Hello and welcome to this instructional video on how to operate and introduce your patients to a Vetario T40 and T50M intensive care unit. Please refer to the product instructions to make sure you understand these before operating the unit. The T40M and T50M are designed solely for the care of small animals under the supervision of trained medical staff. To start up your Vetario Intensive Care Unit, plug it into the mains and then press the start button. The green indicator lamp will illuminate to show the heating control system is now active. The incubation temperature alarm will sound momentarily with a pulse tone to show the alarm sounder is functioning correctly. After briefly showing the software version, the screen display will revert to normal operation and show the current temperature and humidity in the cabinet. Changing settings. The main menu allows the various settings to be modified and saved. All changes are retained in the event of a power cut. To access the main menu, press the minus and plus buttons simultaneously. Press OK to enter each section and plus and minus to adjust your temperature. OK to select. Relative humidity, press OK. This is only adjustable when a Brinsea humidity pump is connected. Press OK. And this is where you will set your alarm high and alarm low settings. Here you can select Celsius or Fahrenheit and OK to save. The temperature and relative humidity are continuously displayed. The green heater control indicator is illuminated. The asterisk next to the temperature reading shows when the heater power is on. When warming, the asterisk will be continuously on. Once warmed up, the asterisk will slowly flash as the heater is pulsed to maintain the correct temperature. When reducing the temperature setting, the asterisk may go off. This is normal. The asterisk next to the relative humidity display is only on when the optional Brinsea Advanced Humidity Pump is connected. If the measured temperature goes up or down by more than the figure in the alarm high or low screen, the alarm will sound and a plus T for high temperature or minus T for low temperature will be displayed. Press this button to silence the alarm for 30 minutes. If the temperature problem fixes itself, the plus T or minus T will remain on the display to show this has happened. Press this to clear the indicator. If the calculated room temperature remains too low or too high for optimum results for more than 1 hour, a warning is displayed. Minus RM for low and plus RM for high, and an alarm will sound. Press minus to silence the alarms for 30 minutes. If the temperature problem fixes itself, the minus RM or plus RM remains on the display to show this has happened. Press minus to clear the indicator. Check the intensive care unit is not or has not been in a cold draft or in direct sunlight or by a heater. This is to make sure that the room temperature has not dropped or increased significantly. To disable the alarm, see section 14 of the calibration menu in your product instructions. For cases when you need a humidity pump, these are ordered separately and they come with the tubing and the connectors separate, so you would just need to fit them like so, and there is a diagram in the manual to show you how to do this. There is also on the front of it a little diagram there on how it should sit. And then the power supply connects to the front of the unit, just here. And it comes with the tubing. The tubing sits in the water pan inside the main chamber. We've given you more than enough, but you may want to cut it down so there's not as much, as you only need a little bit to go just inside the unit. If needing to nebulise the patient, pop medication into the solution holder and pop into the unit. Connect up the tubing and push into place. The other end will then connect to a pump. This doesn't come with the unit but has a universal fitting. If you don't have one, this can be ordered through your veterinary supplier. This section is for oxygen use. We will now go through the safety checklist. Check for cracks and gaps between the upper and lower halves. Do not use if there is any damage to the unit. Do not cover. Monitor the units frequently and switch off the oxygen supply if electrical power fails. Remove the animal if the power failure continues for a prolonged period. Fit the oxygen hose barb to the inlet hole using the lock nut supplied. Check for tightness if already in place. There must be no gap. The hose barb is suitable for hoses with a 6mm or 1/4 inch bore size. Always use a hose clamp device so that the hose cannot possibly fall off. Remove the water pan to do so, as this is easier. Check the oxygen hose for any cracks. Check filters are in place and clean. No auxiliary equipment shall be placed in the incubator. Only use patient connections that are designed for safe use in an oxygen-enriched atmosphere. If any doubt, check with the manufacturer of the equipment. Evaporating block and pan can be used to humidify the air, and if required, a hydrated oxygen supply such as a bubble humidifier can be used too. The incubator must only be used in a well-ventilated room away from potential heat sources. No smoking is allowed. Do not use in a confined location. The incubator needs at least 30 centimetres of free space above and to both sides. Remove all electrical devices, including the water pump, that are within 90 centimetres of the incubator. Disconnect the nebulizer tube. Place the incubator at least 90 centimetres from power sockets. Always test the fan rotation and power failure alarms, and check the ventilation holes are not covered before using oxygen gas. If the alarm sounds during use, disconnect the oxygen supply, disconnect power and open the door to ventilate the care unit. Do not reuse until the fault has been investigated and rectified. Not suitable for use in the presence of flammable anaesthetic mixture. And do not exceed 1 litre per minute flow rate. The incubator contains no flow restriction or pressure regulated device. The oxygen supply must be reliable, restricted to 400 kPa, 50 psi. Always use a medical grade oxygen pressure regulator and flow meter that has been serviced in accordance to the manufacturer's instructions. CO2 concentration will not exceed 0.4% under steady state conditions. It is important to test the alarm systems before using the unit. To test the alarm, follow this checklist. Apply power. The fan must start, but the lamps and display must be off. Press start. The incubation temperature alarm must pulse for several seconds. The green indicator must be on. The red indicator must be off. Press the alarm test button. The alarm must sound and the red indicator lamp must illuminate. If the alarm fails to sound, replace the battery and repeat the test sequence. Press the alarm silence button for 2 seconds. The alarm shall be silent. Open the door and check the fan is now blowing air, that is getting cooler. Close the door, press start and check the set temperature is correct. If the alarm system does not work as specified, do not use. You are now ready to introduce your patient. The temperature should be set to within the patient's thermoneutral range. We have guidelines written by veterinary specialists, but this is always patient specific, so please follow advice of the veterinary surgeon in charge. Only introduce patients once the correct temperature has been reached and is stable. We recommend to run for 20 minutes. Make sure the patient is settled and the latch is secure. IV lines can be placed through this hole. Adjustable air vents to help with the temperature and humidity changes are on the front of the unit. Never cover the fixed exhaust vent. Monitor patients regularly and remain within hearing distance for the alarms. After oxygen use, animals and any cloth materials must be allowed sufficient time in the chamber in normal air to allow trapped oxygen to disperse. You can then unplug the unit and silence the alarm. Following each use of your unit, remove all debris from the floor. Wipe all internal surfaces with a soft cloth soaked in water-based disinfectant solution. This should be diluted according to the manufacturer's instructions. Filters should be inspected before and after use and cleaned if necessary. Remove all 3 filters and gently hand wash in warm water, then allow them to dry before use. Filters need replacing every 6 months and evaporating blocks every 2, sooner if dirty. The exterior of the unit may be cleaned with a damp cloth. For further information on how to clean the unit, please refer to your product instructions. These come with the unit, but they're also available on our website, or you can scan the QR code if you have one on the front of your unit. Thank you for watching this video.